Hello, and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Lowy-Paul, and this week we are talking about chronic spontaneous urticaria. What a Cold War hero can teach us about chronic hives. September 1983. The United States and the Soviet Union are locked into a Cold War of potentially apocalyptic proportions. Both nations hoard tens of thousands of nuclear weapons. The Soviet Union alone has enough to bomb every single county in the US 11 times apiece. On top of this, the Soviets have shot down an airplane with a US congressman on board and are afraid America will launch a nuclear strike. In the midst, Stanislav Petrov, a lieutenant colonel in the Soviet Air Defense Forces, is monitoring data from an early warning satellite system. The system lights up with alarms blaring. It has detected a nuclear missile launch from North Dakota. The alarm sounds again, indicating 5 total missiles. Petrov has to decide whether to report this and risk worldwide annihilation, or to ignore the threat and risk destruction of his country. Stanislav Petrov served as a linchpin in the Soviet air defense system. He needed to determine whether to pass on information for good or ill. In the body, mast cells are immune cells similar to the Soviet air defense system. And inside the cells are receptors, enzymes, and proteins which act like the satellites, radar towers, people, and nuclear missiles that detect and respond to a perceived threat. Mast cells often have a difficult job of trying to sort through information, much of which is flawed and can lead to blisteringly bad results. Chronic spontaneous urticaria, or CSU, is a condition where mast cells in the body drive an allergic or immune response to imagined threats. Chronic indicates that the condition lasts for more than 6 weeks. Spontaneous means there is no known external reason for relapse, and sometimes is called idiopathic. And urticaria comes from the Latin word for a nettle, and refers to the burning sensation common with this disease. Chronic spontaneous urticaria affects around 1% of people around the world, and rates are increasing. It can affect anyone, although young and middle-aged women are at the highest risk. The main symptoms of CSU are hives, called wheals, and or skin swelling, called angioedema. These come with itching, burning, tightness, occasional pain, and may last from 30 minutes to 3 days. Many complications occur as fallout from wheals and angioedema, including discomfort, sleep problems, loss of energy, interruptions to work and daily life, low quality of life, anxiety, and depression. Much like the Soviet defense doctrine, it is unclear what exactly is going on in the body during chronic spontaneous urticaria. There can actually be several different underlying triggers for CSU, including autoimmune problems, autoallergic issues, abnormalities in white blood cells, and so on. Regardless of what causes the initial glitch in danger identification, the next steps are a chain reaction hinging on a few linchpin proteins. On the surface of mast cells are receptors which sense potential dangers and start a chain of signal interpretation and amplification. Mast cells rely on Bruton's tyrosine kinase, or BTK, a critical messenger in the mast cell's threat response system, to release cell contents. Mast cells are filled with signaling molecules, including allergic histamines, platelet activating factors, and inflammatory cytokines. When a mast cell perceives that there is a threat, it releases these contents and starts a process that results in a widening of blood vessels, leakage of blood into tissue, recruitment of immune cells, wheals, and angioedema. Currently, the first-line treatment for chronic spontaneous urticaria is antihistamines that target one of the main molecules released by mast cells, histamine. If this doesn't result in relief, a doctor may increase the dose by up to 4 times. The next line of defense is targeting antibodies that can activate mast cells with the medication omalizumab. If omalizumab doesn't work or comes with too many side effects, the next step is cyclosporin, an immunosuppressive medication. Unfortunately, around 1 in 3 patients do not respond to or cannot tolerate any of these medications. Typically, CSU can last for between 2 and 5 years, although around 1 in 5 patients experience symptoms that persist longer. Let's return to 1983. Stanislav Petrov sees 5 incoming missiles that could kill millions of his comrades. Unknown to Petrov, the detection satellites are misinterpreting sunlight bouncing off high clouds as missiles. He knows that a Soviet response would mean full-scale nuclear war, however, and does not report the launches, deciding it must be a false alarm. The USSR doesn't respond, and Stanislav Petrov becomes the man who saved the world. This demonstrates the power of a sufficiently tuned linchpin in a complex system. Scientists have identified Bruton's tyrosine kinase as a potential linchpin for chronic spontaneous urticaria. If a medication can suppress the release of mast cell contents, it may act as a sort of Stanislav Petrov and stop false alarms from getting out of control to save a patient from years of misery. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.